Today, we saw the largest jump in COVID-19 cases in Tennessee since the outbreak began. But that may actually be a good thing.
That's right. News Channel 5's Chris Davis is live at the Capitol with an update from state leaders. Chris.
Well, Rory, it may be a good thing because that means Tennesseans are getting more access to the COVID-19 test. That being said, state officials admit they're still being pretty restrictive on who is actually tested, but they say if the access continues to grow, if it becomes easier, they may roll back some of those limits. Now, Governor Bill Lee is also trying to increase the number of hospital beds in the state. Currently, 12,000 beds are being used. 15,000 are available right now, and more may be on the way, thanks to him signing Executive Order 15 that will deregulate the use of some hospital beds that can now be used for coronavirus patients. Now, more than half of Tennessee's cases have been based out of Davidson County, which could mean that Nashville has more cases because there are more tests available. But we wanted to ask Dr. Lisa Piercy, what does that mean for rural counties that are still seeing some pretty low numbers? Here's what she told me.
There's also testing available in some remote sites in more rural counties, although you will continue to see that grow, and our efforts are going to continue focusing on providing testing in non-metro areas, because as you correctly mentioned, metro areas are relatively well covered, particularly here in Davidson.
Now, the governor also stressed that because he has declared a disaster in this scenario, small businesses and nonprofits can now apply for low-interest loans up to $2 million through the Small Business Administration. That could mean a big difference for these businesses that are struggling. Live at the Capitol, Chris Davis, News Channel 5.